Fertility nursing was literally the best change that I've made in my career. And if you're interested in switching your career to fertility nursing, I just wanted to tell you a little bit about what it's like to be a fertility nurse on the surgical side. My typical day usually starts between 5:45 and 7 a.m. We usually change, prep all the supplies we need for the day, prep the OR, and make sure that we have everything ready when the first patient shows up, usually about 30 to 45 minutes after we show up. You could be doing pre-op, intra-op, or post-op. We also help with embryo transfers for patients. I've worked for the same company in California and Minnesota, and they both do things a little differently. In California, I would take a patient all the way through. I would start with pre-op, we would go into the OR together, I would take care of her post-op, and then I would send her home. In Minnesota, it's a lot busier at this particular clinic, so usually you're assigned. My personal favorite is the pre-op nursing because I love chatting with patients. Being able to relate to patients, it really helps calm the nerves, letting them know that I've been through this a few times. The hardest part is actually me starting the IV in the day. Most people are just so done with needles by the time that they see me. Just being in a clinic in general, I know it's surgical, so it feels a little less clinical versus being bedside. It's just so different stress-wise. So nice to take care of patients that are so healthy. 99.9% of the time, you're not going to deal with an emergency during your day. We usually set aside 45 minutes to 60 minutes for the pre-op. The OR time is usually about 30 minutes, and the post-op time is anywhere from about 25 minutes to an hour. Sometimes patients get a lot of eggs, and it's pretty painful, and they need extra pain meds. If we give them stronger pain meds, we do have to watch them longer. And then sometimes, even if you get 1, 2, 3 eggs, maybe they were harder to get, maybe they're harder to access, maybe we had to access them from the outside. And so everybody's body is different and everybody's pain threshold is different. The post-op part is a lot less straightforward on timing. If I wouldn't have gone through IVF, I don't think I would have necessarily known about IVF nursing, and I'm literally obsessed with it. Since the day I figured out about IVF nursing, I'm like, someday when my kids don't need me, I'm going to open up my own fertility clinic and take care of patients because I just love it that much. If you're thinking about making the switch from bedside to fertility nursing or just clinic nursing in general, and you have any questions, just shoot them my way. If you have any fertility specific questions, I would also love to answer those. Best of luck to you. I know it's scary to switch your career and completely change what you're doing, but it is worth it. And especially if it's a passion for you, something you've been through, something you can relate to with your patients, I feel like that just makes a huge difference in their lives and yours.